Do you know what hepatitis is? This seemingly simple question opens the door to a vast realm of knowledge about our bodies, our health, and how we interact with the world around us. Hepatitis, a term derived from the Greek words hepar, meaning liver, and itis, meaning inflammation, signifies just that, inflammation of the liver. But what does this mean, and why should we care? Well, the liver is a vital organ that performs numerous essential functions, and its inflammation can have serious implications. There are several types of hepatitis, namely A, B, C, D, and E. Each one has a unique story, with different causes, symptoms, and treatment approaches. It's a complex topic, but don't worry, we're going to break it down together, piece by piece. So, whether you're a health enthusiast, a curious learner, or someone directly affected by hepatitis, this is for you. Let's embark on a journey to understand more about this medical condition that affects millions worldwide. Before we delve into hepatitis, let's comprehend the crucial role the liver plays in our bodies. Often referred to as the body's chemical processing plant, the liver is a powerhouse organ with a myriad of functions. One of its primary roles is to process the nutrients from the food we eat, turning them into substances that the body can use. It also breaks down toxins and chemicals in our bodies, acting as a natural filter for our blood. But perhaps one of the most remarkable functions of the liver is its ability to fight infections. It does this by producing proteins that help our bodies ward off harmful bacteria and viruses. Therefore, the liver is not just an organ, it's a lifeline, a guardian of our health. Given its vital functions, any damage to the liver can have serious implications for our health. Hence, protecting our liver becomes paramount, and understanding diseases like hepatitis is a crucial part of that process. Now that we understand the importance of the liver, let's explore the different types of hepatitis. There are 5 main types of hepatitis, each caused by a different virus and each affecting the liver in its own unique way. These are known as hepatitis A, B, C, D, and E. Starting with hepatitis A, this type is generally caused by consuming food or water contaminated by the feces of an infected person. Symptoms can include fatigue, sudden nausea and vomiting, and jaundice, but most people recover fully with no permanent liver damage. Next up, we have hepatitis B, a potentially life-threatening infection that can lead to chronic liver disease and is a major global health risk. It's transmitted through contact with the blood or other body fluids of an infected person, and symptoms can range from mild illness with few or no symptoms to a serious condition that can cause liver damage or cancer. Then there's hepatitis C, primarily spread through blood-to-blood contact. This one is a bit of a silent operator, often showing no symptoms until the liver has been significantly damaged. Unfortunately, it's also the type most likely to lead to chronic liver disease. Hepatitis D, also known as delta hepatitis, is a serious liver disease caused by the hepatitis D virus. It's unique in that it can only infect you if you're already infected with hepatitis B. So in essence, it's a viral tag-along that compounds the severity of hepatitis B. Finally, there's hepatitis E, a waterborne disease mainly found in areas with poor sanitation and typically caused by ingesting fecal matter that contaminates the water supply. While hepatitis E is usually self-limiting, it can be severe in certain people, including pregnant women and those with weakened immune systems. Each type of hepatitis is unique, and understanding these differences is key to prevention and treatment. After all, knowledge is the first step to staying healthy. Stay tuned as we delve deeper into the causes and risk factors of hepatitis in our next segment. What causes hepatitis and who is at risk? This is a question that requires a comprehensive answer. Hepatitis is usually caused by one of 5 viruses labeled A through E. Hepatitis A and E are typically contracted through contaminated food or water, while hepatitis B, C, and D are primarily spread through blood and bodily fluids. Apart from these viruses, other causes can also lead to hepatitis. Excessive alcohol consumption, for instance, can lead to alcoholic hepatitis, damaging the liver and causing inflammation. Certain medications, too, can lead to drug-induced hepatitis. When the liver is unable to break down a drug, it can result in liver damage, leading to hepatitis. Now, let's delve into the risk factors. Traveling to areas with poor sanitation and high hepatitis prevalence, such as certain parts of Africa and East Asia, can increase your risk of contracting hepatitis A and E. Healthcare workers, due to their exposure to blood and bodily fluids, are at a heightened risk of hepatitis B and C. Unprotected sex with someone who has hepatitis, sharing needles during drug use, And having a tattoo or piercing with unsterilized tools can also put you at risk. Individuals with chronic liver disease or HIV infection have a higher risk for hepatitis because these conditions can weaken the immune system, making it more difficult for the body to fight off infections. Moreover, people born to mothers with hepatitis B or C are also at a higher risk of contracting the disease. It's important to note that hepatitis can affect anyone, regardless of age, gender, or lifestyle. The consequences of hepatitis can be severe, leading to liver failure, cirrhosis, or liver cancer. However, by understanding the causes and risk factors, we are better equipped to prevent and manage this disease. By knowing the causes and risk factors, we can take steps to prevent hepatitis. Our next segment will focus on the prevention and treatment of hepatitis, so stay tuned to learn how you can protect yourself and your loved ones. So, how can we prevent and treat hepatitis? Prevention is always the best medicine, and this is especially true with hepatitis. There are several practical steps you can take to protect yourself and others from this disease. First, let's talk about vaccinations. Vaccines are available for both hepatitis A and B. These are highly effective and are usually given as a series of shots during infancy and childhood. However, if you've never been vaccinated, it's never too late. Adults can and should get vaccinated too, especially if they're at a higher risk. Next, let's consider safe practices. This involves being mindful about personal hygiene and avoiding risky behaviors. For instance, always wash your hands thoroughly, especially after using the restroom and before preparing or eating food. If you're planning to get a tattoo or a body piercing, make sure the establishment you choose follows strict hygiene practices. And remember, never share personal items like toothbrushes, razors, or needles. Now on to treatment. If you've been diagnosed with hepatitis, don't lose heart. There are several treatment options available. For hepatitis A, rest and hydration are usually enough as the body clears the virus on its own. For hepatitis B and C, antiviral medications can be used to slow down the virus and prevent liver damage. In addition to medication, lifestyle changes are often recommended. This may include avoiding alcohol, maintaining a healthy weight, and eating a balanced diet to support your liver health. Regular exercise also plays a crucial role in maintaining overall health and boosting your immune system. Remember, each person is unique and so is their treatment plan. It's crucial to work with your healthcare provider to find the best approach for you. So, while hepatitis can pose significant health challenges, it's not a hopeless situation. With the right preventive measures and treatment strategies, it's entirely possible to live a healthy, fulfilling life with this condition. While hepatitis can be serious, there are effective ways to prevent and manage it. As we wrap up, let's recap what we've learned about hepatitis. This journey we embarked on together started with understanding what hepatitis is. It's an inflammation of the liver, a vital organ that plays a crucial role in detoxifying our bodies, producing essential proteins, and aiding digestion. This condition can be temporary or chronic, and it's important to know that there are different types of hepatitis, A, B, C, D, and E. Each has its own causes and effects, but they all share a common target, our liver. Moving on, we delved into the causes and risk factors of hepatitis. From viruses to alcohol and drugs to autoimmune diseases, many factors can trigger this condition. Certain behaviors, such as sharing needles or having unprotected sex, can also increase the risk. Moreover, traveling to places with poor sanitation can expose you to types A and E. It's clear that hepatitis isn't just a medical issue, but a societal one as well. We then explored how to prevent and treat hepatitis. Vaccinations are available for types A and B, and practicing safe behaviors can significantly reduce the risk of infection. For types C, D, and E, treatment varies. Some require medication, others need lifestyle changes, and in severe cases, a liver transplant may be necessary. But remember, early detection is key. Regular checkups and screenings can make a world of difference. The journey of understanding hepatitis doesn't stop here. It's a continuous process of learning and adapting. This knowledge isn't just for you. Share it with your friends, your family, your community. Let's create a world where everyone is informed, because when it comes to health, every bit of information counts. In the end, the power to prevent hepatitis is in our hands. It starts with understanding, continues with action, and ends with a healthier, hepatitis-free world. Remember, knowledge is power. Stay informed, stay healthy, and spread the word about hepatitis prevention and treatment.